high cholesterol, untreated high blood pressure, lack of exercise, and certainly smoking all can increase the risk of developing heart failure. It's a sobering message to think about in today's stress-filled environment. Here's Carlos Bain.
Heart specialist Clyde Yancey doesn't mince words when it comes to making lifestyle choices that can affect his patients' health.
Our westernized lifestyle that predisposes to obesity really is killing us. I know that's a trite expression, but it really is killing us. You don't need a specialist to tell you if you're carrying a few too many pounds. And all of us could benefit from being more lean and more fit and more active. It does wonders to reduce the risk for heart disease. The best way to deal with this illness is to never have to face it. Then that means that the proactive preventive strategies are premium.
To this day, despite all the technologies that we have available, still the best things we can do for ourselves is to watch our diet and exercise.
To promote a healthy heart, experts recommend a diet rich in fresh fish, chicken, or turkey, with ample amounts of fresh vegetables and fruit. Items to avoid include fried foods, packaged frozen dinners, pizza, canned meats and vegetables, dressings and sauces, snacks containing salt.
So when someone sees that their behavior directly resulted in them feeling less well, there are not that many masochistic people. They eventually will finally say, okay, I need to stop doing this. Once people shift towards a healthier lifestyle where they're exercising regularly, even if it's just a slow walk every day, and are consuming a low-fat, low-sodium, low-cholesterol diet, they prefer that. They actually enjoy that. You don't miss the fried foods and the saturated fats nearly as much as you think you might.
In addition to encouraging people to stick to low-salt diets and to exercise often, heart specialists say members of some groups facing a greater risk of heart disease also should closely monitor their blood pressure.
Certain individuals, especially African Americans, need to have their blood pressure checked and checked with some rigor, and they need to be treated in aggressive ways because on average, the African American patient, especially the African American woman, is at much higher risk for the ravages of hypertension and all its attendant associated problems.
When dealing with heart failure, finding out about the condition sooner is far better than waiting.
It's almost intuitive. If you can identify the person that's at risk before they need to be hospitalized, before they need to be transplanted, before they need to be on multiple drugs and more and more devices, think of the cost implications for the healthcare community and think of the societal implications. Someone who can continue to be a part of their family structure, can work to support their family, can bring self-esteem to themselves and their family. You recognize all of the returns for that sort of a thing.
Sometimes heart failure comes as a consequence of life-saving treatment. Physicians find a number of cancer survivors, once treated with chemotherapy, can subsequently develop heart failure as a result of that treatment. However, the heart failure can be effectively treated. Dr. Jean-Bernard Baron specializes in caring for cancer patients with ailing hearts.
Many patients that were not surviving their cancer are now surviving their cancer with aggressive chemotherapy, only to develop heart failure. It is a very difficult thing for our patients to deal with because not only do they have to deal with cancer, but they also have to deal with heart disease.
But there is reason for these patients to have hope.
One of my patients, who in her late 30s, with a 2-year-old little girl, beat cancer only to go on to develop heart failure. She had gotten to the point where she could not even chase after her 2-year-old. That woman now, she's functioning completely normal. Her heart function is completely recovered, and she spends most of her time playing with her 4-year-old little girl.
Thanks to the advances that have been made in managing heart failure, many patients can continue receiving chemotherapy treatments for their cancer.
Aggressive medical therapy can help these patients to recover their heart function, even while they're actively receiving drugs that are known to be toxins to their heart.